Hello folks, this is Preston Gill. Welcome again to another episode of The Community, your breath of fresh air in local television programming. We're starting our episode off this week at the front of Lane Regional Medical Center. We were invited to meet and greet new physicians at Lane Regional. Lane Regional is now having a vast array of medical practitioners to service here in the community. Go meet some of these new doctors that are servicing Zachary Baker and the whole area on the community. Our first doctors that we're talking to will be a couple of psychiatrists. Well, we used to call shrinks.
Yes.
We have Dr. Parsons, Pam Parsons, and Dr. Greg Harris. I understand Dr. Parsons is actually a resident here in Zachary. Tell me a little bit about what you do in your practice.
At Lane Behavioral Health, we run an intensive outpatient program, which is group therapy for people who are suffering from anxiety, depression, psychotic disorders. They come to groups for 3 hours a day, 4 days a week, and can stay as little as a few weeks to we have sometimes people that end up staying almost a year or so to get the help that they need.
So are we talking inpatient services?
No, actually it's described as an IOP, which is an intensive outpatient program. It's a type of a service that we offer to the community, which helps folks stay away from the inpatient situation by providing biological, psychological, and social model of treatment. Sounds fancy, but actually what we like to do is address all their needs in a way that helps the community and their diseases.
So my understanding, the difference, can you explain for our viewers? Some say, well, I'm seeing need to go to a psychiatrist, some to a psychologist, some to a social worker. What's the difference in the two types of doctors and a social worker in treating a patient with mental illness?
Well, in mental illness, the psychiatrist is an MD. You get your general medical degree before you complete a residency in psychiatry so that you're versed in general medicine, and you also do additional training in psychiatry for the behavioral sciences, which would include not only the therapy aspects, but primarily the medication as well. The other disciplines we serve as team leaders for, as far as social work, nursing, collaboration with the general medical community. We just try to take care of all their needs in one package.
So, Dr. Parsons, if I'm understanding correctly, you'll be the one prescribing the medicine for a patient that's in need of mental health services.
Correct. We are responsible for making the assessment, which will then lead to the diagnosis. We prescribe medications if it's indicated for that particular diagnosis, and like Dr. Harris said, we help coordinate with general medical conditions and their general medical providers, and we serve as leaders of the treatment team for the patients.
So if there's therapy needed to be given, y'all have individuals that will be working with y'all that y'all may refer your patients to, or will you be working with the patient?
We do some of the direct therapy with the patients, but at the intensive outpatient program, the patients are actually in our office, in our location at Lane Behavioral Health for 3 hours a day, 4 days a week. And they are in groups with licensed clinical social workers, family therapists, and so the intense therapy that they get comes through the group experience.
Dr. Parsons used the word intense. It sounds like it is pretty intense.
Yeah, I would say so. That lends to the idea of providing service that would nip any difficulties in the bud from things getting to an inpatient type of treatment being required.
Dr. Parsons, do you see, 20 years ago there was a real stigmatism on mental illness. Do you see that stigmatism still in our society?
I do see it, but I also see it lifting. More celebrities have come out about having mental illness. More people in the general community have come out about having successfully been treated for mental health issues. Family barriers are being broken down. You know, we all remember the days when there was old Aunt Maggie who lived in the attic and nobody talked about her. Those days are falling by the wayside as people learn more about the brain as a part of our body, and our physical body can get sick, and that can be impacted by emotional trauma, and pulling it all together, I definitely see the stigma going.
So now Aunt Maggie's coming out the attic and getting treatment.
Right. Aunt Maggie can come to the IOP 4 days a week. She's out of the house, she's getting her medication, she's getting her group therapy, and that's allowing her to stay in the home but be much more functional and not have to go to the hospital.
Now, in my experience, I tend to sense that there's still a large segment of society that doesn't really understand mental illness, whether it's in small children, teens, or grown-ups. It's almost still they have this thing, well, you could feel better if you just pull yourself up by your bootstraps. Do you think that there's still a segment of society that needs to be educated about the mechanisms of mental illness?
Absolutely. Dr. Parsons was very appropriate in pointing out that we're looking at a disease process and something that can be treated very easily. Just like a person might have diabetes, you would need to take your insulin, you would need to see to your diet. Like Dr. Parsons was saying, your brain is an organ just like the other organs in your body. It's part of what makes us human beings. So part of the education would be to incorporate that philosophy.
Okay. Hopefully in the weeks ahead, I can interview the two of you again, and we can get some more general information about treating mental illness in our community.
Sounds good.
Thank you, doctors. I appreciate it. Thank you very much for joining us here on the community.
Thank you.
Dr. Thomas Kang is the surgeon that's being brought on here at Lane Service Group. Dr. Kang, welcome to Zachary. Welcome to Lane.
Thank you very much. I'm enjoying it here.
We're glad to have you here. Tell me, what is your specialty?
I specialize in general surgery, which means anytime your belly hurts, you might need a surgeon. So hernias, gallbladders, or an appendix if you're having pain lower in your belly.
You've been with the Lane for how long now?
About 3 months.
So how things going so far?
Things are going great. Everyone's very nice. The people I work with are nice, and the patients in the community are all very, very nice people.
Are you taking new patients?
I am. I think there's been a need for a general surgeon for a long time. I think as we move forward, there are more modern surgeries, more modern techniques that we're going to be incorporating into this hospital, and I'm looking forward to that. A lot of new techniques to help people and new techniques to help them get back on their feet after a surgery.
So you've got some of these new techniques that the people here in Zachary can benefit from.
Sure. There's a lot of new technology, new equipment. This hospital hasn't used it yet, but as soon as we get up to speed, we'll start using some of these new techniques that can give people smaller incisions, fewer blood loss, and less pain.
And quicker recovery time, I would assume.
And a lot of times quicker recovery time.
Dr. Kang, is there anything in particular that made you decide you wanted to be a doctor or a surgeon?
Being a doctor runs in my family. I'm the third generation of doctors. I had a grandfather, both my parents, and a couple of brothers and sisters who are doctors. I'm the only surgeon, though. The decision of what kind of doctor you want to be is very personal. It really comes down to how a doctor feels they can help the patient in the best way that their God-given talents allow. So there are people with different countenances, different levels of patience, different levels of eye-hand coordination, and every young doctor makes that decision of how can I use my particular skill set to be the best doctor that I can be.
That makes sense. That makes sense. Well, hopefully you won't see me on a professional basis, but it's good to know that if I'm in need of a surgeon, that we have the surgery center right here in Zachary.
Absolutely, and I'll be happy to help you if you need, but hopefully not.
Thank you, Dr. Kang. Appreciate you joining us here on the community.
Thank you.
Good luck. Dr. Gregory Crenshaw, welcome to Lane Surgery Center. We're glad to have you a part of us. Tell us a little bit about yourself, Doctor.
Well, my name is Gregory Crenshaw, and I'm a vascular surgeon. I did my general surgery and vascular surgery training at Ochsner in New Orleans. I treat all forms of vascular disease, including aneurysms, carotid artery disease, and venous diseases. I'm very happy to be starting here in Zachary, and I'm taking patients. And if you have any of those diseases, come by and see us in the office.
Tell me a little bit about what I can do as a patient to prevent vascular disease so I don't have to see you.
Well, vascular disease happens, it's a combination of genetic factors and environmental factors. And you can't do very much to change your genetic factor, but some of the environmental things that you can change is making sure that you eat right, making sure that you exercise at least 3 to 4 times per week, make sure that you keep your weight down, and make sure that you don't smoke.
So, Doc, do I need to lose this? Huh? Do I need to lose
We
it?
all need to work a little bit on our weight and
And I think maybe some of us need to work a little harder, huh? So, but I understand that the midsection weight is probably the worst type of weight for vascular disease. Is that accurate?
It is. The abdominal fat tends to cause insulin resistance, which tends to worsen vascular disease. It leads to diabetes, and that leads to vascular disease.
Would you say a brisk walk in the morning and the evening would be a good idea for your patients?
A brisk walk mornings would be a great idea, but as far as the exercise part, that's only a small part of it. Diet is the most important part, and keeping a well-balanced diet will keep your weight down, and also adding in exercise will help keep you healthy.
So don't just exercise, watch what you eat.
Yes, because if you are eating bad, you can exercise all you want, and it's not going to help.
So you may keep the calories down or burn the calories off, but are you telling me that certain foods are worse than others?
Well, yes, certain foods are worse than others, and also you need a well-balanced diet, everything in moderation. So you need the diet, which is most important, but in addition to the diet, you need to exercise.
So if I do, while we're on the subject of diet, if there is a little decadent snack that I like, is it okay if I have that a little bit every now and then in moderation?
Sure it is. Like I said, everything in moderation. And exercise helps to burn that little bit of decadence off. And it helps to keep you happy, promote endorphins, and that helps to keep you healthy also.
So hopefully someone's exercise and diet will keep them from needing to see a vascular surgeon. But if they need to see one and they come in to see you, you've probably got a wide range of different type of patients.
Yes, I do have a wide range of patients. Patients with carotid disease, and we do carotid disease to prevent strokes. Patients with aortic aneurysms, and we fix those to prevent ruptures, and also a large number of patients with peripheral vascular disease that have what's called claudication, where you have pain when you walk or pain in your legs at night when you are asleep, and we treat all of those patients.
Dr. Crenshaw, we appreciate you being on the community with us today. Welcome to Zachary. Welcome to the Surgery Center here at Lane. Best of wishes with your practice.
Thank you very much.
Thank you. Dr. Jones, good to see you again.
Thank you for having me, sir. Appreciate it.
Look, we met you when you came into your new office on the other side of town.
Yes, sir.
Now you're back over here where the hospital is for the meet and greet. Tell us, our viewers probably saw a little bit about you the first time, but tell us your name, where your office is, and what you do.
Sure. My name is Stephen Jones. Office is 19900 Old Scenic in the Fast Lane Clinic. Name of my practice is Lane Family Practice and Sports Medicine, and I'm a family practice and sports medicine trained physician.
So, Dr. Jones, we've got a lot of athletes here in the community, both teenagers and a little bit older. As a sports medicine doctor, how do you service those?
Well, I've actually had the opportunity to work a few of the Zachary high school football games, and I've seen quite a few of the middle school and even over at Copper Mill. But I like to inform people it's not necessarily structured just for athletes. You know, sports medicine is the weekend warriors, a guy like myself who is going out and maybe overdone it a bit. You know, hurt my shoulder, hurt my knee. Or even you know, a older gentleman who went out. I saw a guy who was out raking after the hurricane. You know, older gentleman hurt his knee. So I mean, these type of overuse things, kind of common musculoskeletal injuries that I see in my clinic.
So I got 2 bad knees right here that have been bothering me for about a year.
Come on in, we'll take care of it.
I need to come see you.
Absolutely.
And what can people do to prevent injuries?
Well, mostly, it's to remain active. I mean, if you're you have sedentary lifestyle, and then you go out and you try to overdo it, so to speak, then that's the best way to cause an injury. Now, as far as prevention, remain active, and what I recommend and what the American College of Sports Medicine recommends is 3 times a week, 30 minutes a day. To the point that you break a sweat. We're going to go in the right direction.
How important is it to do warm-ups and cool-downs?
Huge. Actually, more so the cool down than the warm up. The warm up, I mean, something light just to warm the muscles up. And then actually, some studies have shown that sitting even in a tub of hot water warms the muscles up, enough for activity. But what most people neglect is the cool down period, which is afterwards you absolutely have to take 10 to 15 minutes to do some cool down. Now, the thing I also see is most people from the children to the adults neglect hydration. Absolutely have to keep hydration on board.
Water, hydration. How about Gatorade and things of that nature?
So what I recommend is water hydration throughout the day. No one gets their 8 glasses a day, but if you can get that, especially if you're an athlete, it's relatively necessary. Now, during actual activity, when you're losing most of the sweat, Gatorade, Powerade, electrolyte substances are best.
Now, you said most people neglect the cool down. Hey, I'm one of them.
Oh, yeah.
Tell me what I'm supposed to do when I'm through.
Okay, so cool down specifically, I like to take about 10-15 minutes and it doesn't really matter what type of stretch you do, whether it's active, dynamic, ballistic. I just want you to reach and actually try to extend yourself a little further than your end point. Hold it for about 5 to 10 seconds and do it again, and make sure you do both sides of both upper and lower extremities.
So a little bit like the stretches we did for warming up?
Absolutely like the stretch you did for warm up, except when you cool down.
Well, Dr. Jones, it was a good pleasure to have you back with us again.
Yes, sir.
And I hope our viewers may have picked something up. I know I did. Thank you for this information. Again, welcome to Zachary, and best of wishes in your practice.
Absolutely. Thank you for having me.
Thank you, Doc.
Thank you.
Appreciate it. We have Randy Olson, CEO of Lane Regional Medical Center. Once again, Randy, appreciate you joining us.
Sure. Thank you.
We
Thank you.
just met almost half dozen, 5 of your outstanding new physicians.
Yes.
But I understand that isn't all you've got coming in.
No, there are 3 of them that couldn't make it here today. The first one is Dr. Sam Field, who is a general surgeon, who is joining Dr. Kang, who you interviewed, and he has his office practice here on our campus. He's in his mid-40s, so he's been around the track a few times. He worked at Baton Rouge Clinic for a number of years, and then he went over to the Gulf Coast of Mississippi and did some trauma surgery there. And we're able to lure him back to Baton Rouge, which is his home.
So some real experience there.
Very much so. So he's bringing experience, maturity, and all the things that we really need to.
And Dr. Kang has the new techniques.
Oh, he's wonderful. Of course, he's Ochsner trained, as you heard, and he's wonderful. Sam is actually kin to some of the folks up in southern Mississippi, the Field Memorial Hospital up there. That's his family.
Wow, awesome. So he's really got a background in medicine.
Yes. Plus, his father was a general surgeon in Baton Rouge for a number of years before him.
All right, so now who else do we have?
Garland Green, who is a cardiologist who has joined Cardiovascular Institute of the South. He used to practice in Baton Rouge with another group, but he's joined that group, and he's going to be sharing his time here in Zachary and also in Baton Rouge. But he's an interventional cardiologist who will use our cath lab, take care of patients who have cardiology issues. He'll be able to do stents, be able to do anything that a normal interventional cardiologist can do, and he's really great. He's Vanderbilt trained, so he's bringing the knowledge and residency program of Vanderbilt to Lane.
And folks, for you that don't know, Vanderbilt is one of the premier institutions, and I'm not knocking LSU, but Vanderbilt is one of the premier medical institutions here in the country.
But they don't have nearly as good a football team.
Or basketball or baseball.
Actually, basketball. I think they got us in basketball. And a family friend of
Johnny Jones is going to change that.
yeah, and a family friend of mine is the head coach of the Vanderbilt baseball team, so I have to be careful.
Okay.
So don't put this in Nashville, okay?
Now that you've got Cardiovascular Institute of the South down here, y'all have got an outstanding program, don't you, Randy?
We really do. When we started in looking at cardiology services here back in 2005, we didn't know exactly how to do it. We thought we have to bring it in, develop it ourselves, and then we found CIS, Cardiovascular Institute of the South. We found them headquartered in Houma, so not too far away, and we asked them if they would be a partner with us to put together a program, and we have put together a state-of-the-art program doing things at Lane that nobody else in the Baton Rouge region is doing, and it's really wonderful.
And I can attest, last year Dr. Thompson saw me for about a year trying to resolve some cardio issues, and the care that I got from your physicians here at Lane was amazing. It was just like my mama taking care of me.
Oh my goodness. Did she have a medical degree?
No, she had a mama degree.
She had a mama degree. I understand that. No, we know that people in the area have choices. And it doesn't make any sense that Lane not have the same quality and hopefully hometown care that a larger hospital in Baton Rouge has. So we know people have choices, and we want them to choose Lane for those reasons.
Well, I can attest. My dad had some serious surgery around the same time that I was going, and it was in Baton Rouge, and I won't name places or anything, but I'll give Lane a 10, and the other place didn't get a 10.
Well, good. Thank you. We're really pleased with what we've been able to develop.
Now, we have a third doctor that's joining us.
Yes, Dr. Nishiwa, who actually has a practice in Baton Rouge. He's a rheumatologist, but he also comes out here 1 day a week, and it's a new specialty that we haven't had at Lane ever before, and a lot of older people need rheumatologists to take care of various disease processes, and he's bringing that again here so people don't have to drive into Baton Rouge or go anywhere else for rheumatology care.
And if you need a rheumatologist, I don't think you want to be in your vehicle an extra 30 minutes to go into Baton Rouge, do you?
No, you don't want to be in your vehicle for anything for an extra 30 minutes, and 30 minutes is probably an understatement. To get to some of the other hospitals and offices down there, it's more like 40, 45. By the time you park and walk, too.
Yeah. And parking and walking isn't a problem here.
Yeah. No, he can park at the front door of his office.
Randy, you have brought Lane along so far and so much in the last 10 or so years. It's amazing. I was raised here in the community. I remember when Lane was not the Lane that it is today. Right. And this is really an amazing facility. It's a credit to the doctors, your staff, everybody is really bringing this to one of the premier hospitals in the region.
Well, when I came here in May of 2003, we were starting on a strategic plan, a strategic initiative on what we need to do to kind of maintain viability of Lane. Actually, we were struggling back in 2002, 2003. And one of the major tenets in our strategic plan was growth. So how do we do that? We bring in new doctors, we bring in new specialties, we bring in cardiology, we bring in, and I'm going to share with you in a few minutes, radiation oncology. These are services that people have had to go long distances before to get. We can bring them right here to Lane.
All right, now you've piqued my interest. What is this about radiation oncology, and what is that?
Radiation oncology is a service line where patients who have cancer, where a physician, a radiation oncologist, which is a highly trained physician, can pinpoint where certain lesions or certain cancer sites are, and they use radioactive beams to go in and pinpoint those and knock them out to kill that tissue.
Wow.
And it's highly trained, it's highly localized. It's not like sort of chemotherapy, which sometimes has to kill other cells to get to the bad cancer cells. This can be localized to hit exactly where that cancer is.
So does that mean it'll cut back on some of these side effects that chemotherapy and other treatments have?
That's my understanding. With cancer, there are side effects for anything that you do. But let me tell you what this means to Lane and what we have ahead of us. We probably will have this open and running hopefully by November, December 2013. So we still have 14 months or thereabouts.
So stop. we were talking about radiation oncology, but you're telling me that Lane is fixing to have that.
Yes, we're bringing it to Zachary. Yeah, what we're going to do is we're going to build $1 million building. It's what they call a vault, where you put a linear accelerator, which is this machine that sends those beams into the cancer cells, and what it'll do is we can bring patients here to this cancer center. And what it'll do is the patients can be here, and sometimes the treatments are less than 10 minutes, but they have to be done multiple times during the week. So if patients live in Zachary or the Felicianas or anywhere up in this area, they can come here for those services and not have to go anywhere else. But again, this vault that we're going to be building is surrounded. There'll be 6 feet of concrete around the linear accelerator, which is a unit. The unit is going to cost almost $2 million.
More than the building.
Yeah, well, and the vault is going to cost a little over, well, about $1 million by the time we're going to do it. But we have an empty office space that can be used for that, and then in the back we're going to build this vault.
And where would that be, Randy?
It's in one of the medical office buildings right across Main Street from the post office.
Okay, so
right on our campus here.
wow, so you're really expanding here. Now I understand that this is a partnership that you've got.
Yes, we're in a partnership, a joint venture with Baton Rouge General and the 2 radiation oncologists, the 2 physicians who will be servicing us, Doctors William Russell and Andrew Love. So the 3 of us, Lane as an entity, Baton Rouge General, and the 2 physicians, we're going into this together so that we make sure that we all 3 focus on quality and doing the very best we can for the people who live up here.
So now I'm thinking, Randy, we've spoken to vascular surgeons, general surgeons, sports doctors, general practitioners, cardiologists. Lane is your one stop for medical needs, isn't it?
We're trying to,
and even psychiatrists.
Yes, we're trying to make it that way, but you know, being a smaller hospital, sometimes it's harder to get multiple numbers of the same specialty, because in most cases, if you need about 3 of each doctor to take care of call rotations and things like that. So and the neat thing that we're doing with the vascular surgeon who you just met is that he's part of a group in Baton Rouge, but he is at Lane full time. So he can piggyback on them. So when he has to be gone, one of those guys can come up here and help cover for him. So we're trying to do everything. We're trying to be real creative in how we bring specialties here.
Randy, we appreciate you joining us on The Community, and it's amazing what's going on here with the hospital, and we appreciate you inviting us here to meet your doctors. It was a real pleasure, and I'm sure that they will be just one more added straw in the hat of Lane Regional Medical Center.
We're going to do the very best we can because our community deserves it.
Thank you, Randy.
Thank you. Thank you.